So, hello everyone, and welcome to OPG Hub. I'm Dr. OPG. So, today we're going to talk about something very important, which is Eguho. Yeah. So, I'm going to share with you 10 things that you need to know if you don't know it, which is Eguho. Hello, Senior Romeo. You're welcome, you're welcome, you're welcome. I hope you're fine. Yeah. Thank you for saying hi. Thank you for saying hi. Yeah. Thank you for joining the live, and I really appreciate it. Okay, so today I'm going to show or share with us 10 things that you need to know. Okay, if you don't know it, which Eguho. So kindly share this video to your loved ones and friends, and let's look at them as soon as possible. Yeah, thank you so much. I really appreciate you joining the live. Yeah, so let me also know where you are watching us from. When you're watching us from America, China, Algeria. I think yesterday or yesterday back, I had someone watching us from Algeria, right? So you can share this video to your loved ones. I really appreciate you joining us. So let me just share this video. The link to my friends and loved ones. I'll just be back in a jiffy. All right. So hello everyone and welcome. I really appreciate you joining this live. I wanted to share this video to your loved ones and friends. Today we are going to talk about 10 things you need to know. If you don't know it, Wichi Eguho, Wichi Eguho. So I'm going to share with you these 10 things, okay? So just do me a favor, kindly drop in the comment section. Let me know where you are watching us from. I understand some of you are watching us from Ghana, Nigeria, America, and co. So drop in the comment section. I want to have that interaction with you. I hope you're all fine. Yeah, great, 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 great. So the first thing I would like us to know that if you don't know Wichi Iguho is one. Are you ready? So I have it here. I'm going to read everything to you. You see, when we say Wichi Iguho, we are actually trying to tell you that your body is trying to warn you. Your body is trying to tell you something, but it's just that you are ignoring it. And so because you are ignoring it, or probably maybe you don't even know, that is why Wichi Iguho. Wichi Iguho means that uh, you are not aware of what is actually going. You think you are covered, but actually you are not covered. Okay, so I'm going to show you in this video today 10 things that you need to know as soon as possible. If you don't know, then that may be a problem. So I'm going to mention the first one. Okay, and you need to pay attention to these things that I'm going to share with you. But kindly do me a favor by dropping in the comment section where you are watching us from. If you can have any questions you want to ask, any question, you can ask it in the comment section. I'll be glad to answer them for you as well. So the first one is when you have swollen legs. Now, when you have swollen legs, it has a lot of meaning, or it has the body is trying to tell you a lot of things, and I'm going to mention about two of them that you need to know. Okay, if you don't know it, which Eguo. Okay, so the first one is anytime you have a swollen leg, I want you to picture three particular organs that may be involved. There are other organs that may be involved, but then there's three particular organs that may be involved. So we have the heart. So any heart condition, let's say heart failure, can or your heart is failing, can make you have the swollen legs. Okay, and these swollen legs we're talking about, when you touch the legs, you can see that the leg goes in. It's like a deep in. You see, if you have seen a hot bread, okay, a hot bread. You see, when a hot bread, you get a hot bread and you put your finger into it, it dips. Exactly. That's what happens on the legs. So one of the conditions that you usually shows with hearts, with swollen legs, or what we call the pedal legs, pedal edema, is the heart. So if you have a problem with the heart, your legs begin to swell. Another organ I would like to talk about is the kidneys. So if you have a kidney disease or a kidney failure, your leg also begins to also fail. I mean, you begin to see your leg swelling up. Then the third organ I would like to mention is if you have a liver disease, what we call the chronic liver disease, your legs begin to swell. That in this case is as a result of albumin, okay, low albumin, and so your legs begin to swell. Now I've mentioned three particular organs that can make your legs swell up, and if you see your legs swelling up and you don't do anything about it, or you don't notice that your body is trying to tell you that your heart is failing or your kidneys are failing or you have a liver failure or liver problem, then which ego. So I've mentioned the first one, as I'm going to share with you 10 things you need to know. If you don't know them, which ego. So I've mentioned the first one. I said that your legs will, when you notice that your legs have gotten swollen for the past days or few months, then you need to be aware that you are dealing with something specifically within your heart, your kidneys, or your liver. I hope you got it right. So kindly drop it in the comment section if you got the first point. And yes, sir, Wichi Eguho. All right, sure. So let's do the second one. The second one, but please do me a favor. Kindly don't forget to share this video to your loved ones and friends and let them all subscribe to this channel. So we should all share the video, share the video, share the link, share the link. Hello, Beniko. Yeah, you're welcome. I really appreciate you joining. Thank you so much for joining. Benicio Bienes. Yeah, thank you so much. I really appreciate you joining. I really appreciate. I hope your day was very okay. Tell me where you are watching us from. I want to know where you are watching us from. Okay, I have a new friend. You're my new friend, okay? Uh-huh. Okay, so when we say Wichi Eguho, what we mean is that you are actually exposed, but you think you are covered. Okay, you're actually exposed, but you think you are covered. So there are some. All right, great, 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 great. But where are you watching us from? I want to know where you're watching us from. Maybe Ghana, Nigeria, Algeria, America, China. Let me know. So if I need to speak Chinese, I can speak Chinese too. So you can take it from there. Yeah. All right. Okay. Benicio BMX. So where are you watching us from? Okay. The second thing I would like to talk about is the second thing I would like, as I'm going to share with you 10 things that you need to know. Okay. So the second thing I would like you to know is when you see your eye or your eyes yellow, okay, if you need to take something, you need to do something about it, or you need to, your body is trying to warn you about something. Thank you. I really appreciate. I really appreciate. I don't take it for granted. Thank you so much. Yeah. So I've mentioned the first one. I said if your leg swells up, your body is warning you about a certain condition. Okay. And the second thing you need to know is when you see that your eyes are yellow, okay, it is not the beauty of it. The beauty of it is to your body is trying to tell you something. All right, my good friend Benny shows BMX. Yeah, thank you so much. I really appreciate. You are now my good friend. Oh. Yeah. So when your eyes are yellow, um, the body is trying to tell you something about your liver. Okay. So if you don't know about this, which ego, okay, your liver may be having a chronic liver disease, and that's one of the manifestation or what we call the stigmata of chronic liver disease. One of the things that you begin to see is the yellowing of the eye. In fact, there are other body changes that you see on your skin or on your body or your hands or your face that may be telling you about what we call a liver disease, what we call a chronic liver disease. This chronic liver disease may be as a result of hepatitis B infection, hepatitis C infection, or long intake of alcohol for a long time can damage your liver. And then that can be the manifestation of what you see on the person's eyes. So the eyes can become yellow. All right. Uh-huh. Sometimes they maybe from underlying causes like from sickle cell and stuff. But then this particular one usually is from hematological cause and has its relationship with the liver. Okay, so when you see your eyes getting yellow, you should be worried about. I remember one time there was this friend who says that, oh, he saw like he one day he was watching the mirror, then he saw, I mean, sorry, she saw her face, and then she saw yellowing of the eye, and then she became very worried. All right, let's go. Yeah, we are going. We are going. We are going. We are going. We chi ego. We chi ego. Yeah. So she became very worried. Apparently, she was like, ah, how come my eyes are yellow? Then he asked his roommates that, oh, my roommate, my eyes are yellow. When did have you noticed that my eyes are yellow? They were like, hey, yeah, yeah, we noticed your eyes were yellow for about a week now, but we're finding it difficult to tell you. All right. So apparently, her eyes was yellow, and then they were finding it difficult to tell her, and that could be an underlying cause of liver disease. Okay. So one of the things you need to know is that. So I've said I'm going to show you 10 things. I've mentioned two. If you don't know these 10 things, which ego. So the first one I mentioned, what did I mention? I mentioned what? Swollen legs. The second one is what? The second one is what? If you know, drop it in the comment section. The second is one is what? When your eyes get yellow, yellowing of the eyes. Okay. If you don't know that, that's a liver disease, which ego. Let's look at the third one. But then kindly do me a favor, share this video to your loved ones so we can all learn about this. So that you know why. Yeah. Okay. The third thing I would like to share is is persistent cough. Now, this cough I'm talking about, usually like about 1 week, 2 weeks, the person has been coughing, coughing, coughing. That can give you a lot of your body is trying to tell you a lot of stuff. It could be as a result of tuberculosis. Okay, so if the person is coughing and you sometimes blood stained for a very long time, you'll be thinking of, is it your, okay, I don't get your the emoji. Yeah, maybe if you can say explain it further, but then your, I think my face is not clear. Okay. Oh, okay. Thank you so much. I sincerely appreciate it. You can come and rewatch the video later. Okay, I really appreciate it. Thank you. Thank you. Thank you. Thank you. All right. So the third one, I said a persistent cough. If someone has been coughing for a very long time, it could be a sign of tuberculosis, especially if there's weight loss, night sweats, and together with a persistent cough and sometimes a blood stain in the cough, that could be a sign of tuberculosis. And sometimes cough too can be some underlying conditions like heart failure. For persistent coughs, it can be like heart failure. So when you notice any of these things and you don't act fast, your body is trying to warn you, you don't act fast. Which ego. So you get it. So I've mentioned three things. The first one is swollen legs. The second one is the eye, yellowing of the eye, which may indicate that your liver may be at a problem. Then the third one I've mentioned is when you have persistent cough. It could be a sign of heart failure, TB. It could be asthma. Okay, asthma too can come with cough. But like the cough, let's say for 3 days, you're having some fever, some chills, together with maybe when you cough, there's a yellowish sputum inside the cough. It may be as a result of pneumonia. So getting to know the duration of the cough helps us to know that actually dealing with a TB or a pneumonia or an asthma or even like a heart failure. Because heart failure, as I said the last time, if you watch my live stream about heart failure, I said that they have what we call a fruity sputum or something like a white. Some people complain that they have a whitish sputum inside the cough. Yeah, so that could be one of the things. All right, so you can drop your comments in the comment section and I'll be glad to answer them. So let's go to the fourth one. I said I'm going to mention 10 things to you. If you don't know it, wichi iguho. Your health is telling something, but you are ignoring. So wichi. Iguho. So let's look at the fourth one. But please don't forget to share this video to your loved ones and friends so we can all learn together. Okay. The fourth one you can talk about is chest pain. Chest pain. That's the fourth one we are talking about, chest pain. Now, if you notice that your chest, let me make it like this for you to understand. Now, when you see the chest in itself has very important organs over there. We have the heart, we have the lungs, we have quite a number. In the heart, we have some blood vessels around the aorta and stuff. Then there with the lungs too is also in the chest. What else is in the chest? Yeah, at least these two is very important. And we have the esophagus, like the link from your mouth to your stomach, passes through the chest area. So we have very important things over there. We have the muscles and then the ribs, all of them are in the chest ridges. So if you have a chest pain, it may be from any of these I've mentioned, but most importantly, your lungs and your heart are very important, especially the heart. So if you have a chest pain and you don't really take your time to understand it, your body may be trying to warn you about something very urgent or that is an emergency. But if you ignore it, wichi, wichi, you go home. So that's what I want to show you. So when you have a chest pain, and then when you breathe in, it becomes worse. And sometimes when you lean forward, it becomes better. You need to go to the hospital as soon as possible, else which you go. Or sometimes you have some severe pain and it is central. And that chest pain, you feel like something is tightening the chest, like an elephant or something heavy is tightening the chest, is sitting on the chest, what we call the elephant on the chest experience. And then sometimes that pain on your chest moves to your left shoulder, your left jaw, and sometimes to your left arm. That is a warning. That particular chest pain, you don't have to joke with it. You may be having what we call a heart attack or myocardial infarction. So you need to go to the emergency as soon as possible for further treatment. You can also have some chest pain, which may be as a result of pneumonia or tuberculosis, heart failure, or something like that. So don't take chest pain for granted. Anytime you have chest pain, don't take it for granted. The underlying cause may be from your heart, from your liver, even from the muscles of your chest walls, and also you can have what we call GERD, okay, gastroesophageal reflux disease, can also present with chest pain. So anytime you have chest pain, let's just uh, take note to identify when it started, how it is, what was the character. Have you done something about the chest pain? What did you do about the chest pain? Does the chest pain get worsened anytime you breathe in and out? That's what we call a paretic chest pain. So if you notice these things about chest pain, you need to act fast, because if you don't act fast, and as I said, the heart is at the chest region. So if you don't act fast, something will happen onto you, and then you say something else. So you need to work out fast, else which Iguho. So I've mentioned this about the first. So what is the first thing I mentioned? What is the first thing I mentioned? I mentioned that what swollen legs. If you have swollen legs and you don't act fast, the swollen legs may indicate that your heart, your liver, sorry, your heart, your liver, and your kidneys are involved. Okay, and the last time I told you that your heart and your kidneys are best friends. Your heart and your liver are like are brothers. Okay, so take note of it. So any of these three things, when they get failed, heart failure, kidney failure, liver failure, they can present with swollen legs. So when you notice swollen legs, just be mindful of that. And the second thing I mentioned was what? Yellowing eyes. I said when you have a yellowing eye, you can come drop a comment in the comment section. I would like to read as well. If you have a yellowing eye, it may be as a result of an underlying disease from the liver, what we call the chronic liver disease. And as I said, it could be as a result of hepatitis B, hepatitis C infection, or a long-standing. All right, Betty Espana, thank you so much for saying hi. I really appreciate it. I really appreciate it. God bless you so much for. Do you have any question? Any question you'd like to ask? I'll be glad to answer. But by the way, how was your day? Okay, great, 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 great. Yeah. So that's the second thing, yellowing of eye. And the third thing, as I'm going to mention 10 things you need to do or you need to know. Okay, okay, great, great. Yeah, thank you so much for commenting. I really appreciate it. Betty Espana. Okay, your name sounds nice. So are you from Spanish or Mexico? Because they use the Espana, Esperando, and stuff. Nice meeting you. I'm sure she's from Mexico or from Spain or Canada or something like that. Okay, yeah. So the third one I talked about was chest pain. Okay, I talked about chest pain. Right. Then I talk about persistent cough. So I've mentioned four things. If you don't, if your body is actually trying to warn you, but then if you ignore it, which let's look at the fifth one quickly. Um, Sudden weight loss. Okay, sudden weight loss. Now, when you notice that you have lost weight, especially your usual dress that you usually wear. Okay, I know some of you like wearing some Gucci, name them. I think I have some names of clothes. The last time I was going to the cloth shop, and then they have some names, very interesting names. I think maybe the list know a lot of their names. I think they have Hollandia, they have Hollantex. What else? I even heard they have Mahama. Yeah, when I went to the shop, I was like, hey, wow, they have Mahama. Yes, there's a cloth like Mahama. There's a, if you know some of them, you can drop them in the comment section. I just learned, you see, I like learning something new. So I went to the television, the fabric shop, and I got to know of the names. So I want to share them with you. They say they also have what oh uh, grandpa. Yeah, they have grandpa. They have Mebawa Brochi. They have quite a number of those clothes. So what am I trying to say about this? I'm trying to say that when you notice that you have lost weight for a number of weeks, usually the dress that usually you wear that fits you, all of a sudden becomes loose on you, especially you can feel like your waist. The dresses now when you wear around your waist, they become very loose. And if it's there, your weight loss for about 6 months, 2 months, you need to be worried because it could be as a result of a cancer. Yes, yes, yes. Cancer can make you have weight loss. You can lose weight completely. And then also you'll be having some, I mean, the B symptoms like night sweats, some fevers and stuff. They can all paint the picture of malignancy, an ongoing malignancy, especially if your weight loss has been there for a long time. I understand sometimes when you're going to write exams, sometimes you lose a bit of weight. There are some people when they come to school, they are slim. When they go home, they become fat. And the reason is that when they come to school, they are stressed. So it's really, so that one can be normal. But I'm talking about someone who has lost significant weight, like let's say has lost about 10 kg in the past month or 5 kg in the past month. You should be worried because that's not your usual weight. So with what I said, you all need to know your weight. Okay, so make sure you know your weight. Let's say you are weighing 80 kilogram, at least every 3 months or 2 months, try and check your weight again to see if you are losing weight again. At least you should be around 81, 82, or 87, 80, 78. Just plus one minus two weight. So you can know, you can easily detect when you lose weight. Okay, because as I said, it could be a sign of what a cancer or what we call a malignancy. And that pain that can come in when you lose weight can also be what we call TB. So if you have weight loss, night sweats, and the night sweat, I mean that sometimes when you sleep on the bed, your bed sheet becomes soaked with sweat, and there's some fever, elements of fever, and maybe you are coughing for a long time, then my mind or our mind will be thinking of maybe you are dealing with a TB, because TB can also present with weight loss. Okay, yeah, yeah. So basically, when you notice that you are losing weight, okay, you need to act fat. And yes, sir, which ego. So how many have I mentioned so far? Tell me how many have I mentioned so far? I've mentioned swollen legs, yellowing of the eyes, persistent cough, chest pain, and then weight loss. So it's left with five. That's I'm going to give you 10, 10, 10, 10. So I've mentioned five. So don't forget to share this video to your loved ones and friends so we can all get updated. And yes, sir, yechi iguho. Okay. So let's look at the seat one. The seat thing that we need to know is when or if you need to know, else when your body is trying to expose something to you. If you don't know it, you don't know. But if you don't know it and you don't act fast, which ego. So the sick thing that your body is trying to tell you is when you have frequent urination or excessive thirst. Now, when you have frequent urination or excessive thirst, your body is trying to tell you that you may be having, I said you may be having what we call a diabetes. Okay. So there's three things I always want you to know when it comes to diabetes. When I'm asking people about do you have diabetes or something, these are the three things. Do you urinate frequently? Now, do you urinate frequently? What we call polyuria. Now, it's relative. Some people say, "Oh, I drink a lot of water, and so that's why I urinate." Okay, I drink a lot of water. That's why I urinate. That's fairly fine. But these people that I'm talking about, they urinate frequently. They can urinate like, especially in the night, they can urinate like 5 times, 6 times in the night before daybreak. Okay, that's what we call nocturia. That's worrying because ideally at least 2 times in the night is fine. Sometimes when as we are aging, you can have like 3 times in the night or once in the night, or sometimes no, it's fine. But like 5 times in the night, 6 times, you should be worried. All right, that's nocturia. People with BPH, prostate diseases, can also have that night urine. But with these people I'm talking about, polyuria, they urinate very frequently. They can urinate very frequently. Then another thing is that they get feel like they feel very thirsty frequently. So small time they feel like they want to drink water, and so they take in water. Okay, so they can take in water right now, and they'll be like, they still need to take another water. So when you notice that you usually take a lot of water, this is not like your usual taste of water. Because I know some people they can take like 6, 7, 8 sachets of water. That's fine. But this person, this kind of person, that is not his usual style. All of a sudden, he has that desire to be taking a lot of water. Then the third one is what we call polyphagia. He or she easily gets hungry quickly. So he can get hungry right now, eat some food within some shortest possible time. He or she is still hungry. Do you get it? So when you notice any of these things, these three things I've mentioned, polyuria, I prefer to always call it the three P's. Okay. Polyuria, that is plenty urine. Polydipsia, that is what uh, you feel thirsty, okay, frequently, and then polyphagia, you feel hungry frequently. Okay, the reason is also very simple. This just I'm just trying to explain it in a way for you to understand. Now, the sugar or the glucose of your body needs to enter into your cells for the cells to use it. Okay, so but then there's a problem with your insulin, or the cells that needs to respond to the insulin, what we call, let me say, a padlock and a key. Now, when there's a problem with the padlock and the key, the insulin and the receptors, what will happen is that the glucose cannot enter into the cells for the cells to use. So eventually the glucose will remain inside the bloodstream. Do you see it? So once they remain inside the bloodstream, toxic things in the blood will eventually go to the kidney, and the kidneys has to wash them out. But as it's washing them out, glucose is one of the things that it needs not to wash out into the urine. All right. And so, but then because there has been abundance of glucose in the body, the kidneys try to wash it out. And once it washes out, water follows. And so that's why when the person have a lot of glucose inside their body, water follows. So the person will be urinating frequently. Now, once the person is urinating frequently, as the body is trying to clear the glucose inside the body, inside the blood, the person will be urinating frequently. As I said, water follows where the glucose goes. Now, because water follows where the glucose goes, your body's kind of water becomes low. So because your body is an intelligent organ, it will start stimulating the test hormones for you to start feeling thirsty so you can drink in water to replace the ongoing loss of water. Do you get it? Aha. At the same time, because the glucose is also not going to your bloodstreams, into your cells for the cells to get um, the energy they need to help in the metabolism and other stuff, the body will still send signals to the brain that you are hungry. So you need to eat food. So that's why you still go and take in food. You take the food all right, but the glucose will not be able to go into the cells. So you get a picture. So that's how come you feel hungry, you urinate frequently, and then also you feel thirsty. So these are the three things that you begin to see. Now, just to add up to it, if you have a family member or a so close family member like your mom, your dad, or someone very close who has a DM, diabetes, you stand a chance of also having it in your old age. Okay, but DM, diabetes, is not only found in the elderly. Okay, take note of that. It can be found even in young people. Yeah, you can find it even young people. The type 1 usually in young, type 2 usually in the old. But it doesn't mean that young people don't get diabetes. They get, okay, so anytime you hear diabetes, or sometimes when they come to the hospital, they ask you, oh, do you have diabetes? You say, no, you have not grown. Why would I get diabetes? No, it can happen in young. So once you notice any of these things, even in your young children, teenagers, and they complain of urinating frequently, eating frequently, and stuff, and sometimes weight loss and stuff, you should be mindful that you may be having what, a DM. So I've mentioned that these few things. If you ignore it, which ego. So I've mentioned 6 things, right? As I'm going to give you 10. I've mentioned 6 things. So it's left with a fourth, four more, four more, four more, four more. But then share this video to your loved ones and friends. Don't forget to also drop in the comment section as well, so we can all get updated as well. Ha. Four more, four more. Oh, share it, share it, share it, share it. And you can ask me any of your questions and I'll be glad to answer them as well. All right. Okay, let's go to the seventh one. The seventh one, shortness of breath. Now, or what we call difficulty breathing. Now, as I said, if you have difficulty breathing, it has a relationship with your chest. Okay, so there are very important organs in the chest that I would like you to still. I want to stress on again: the heart, the lungs. Anytime you have difficulty breathing, it may be as a result of these two organs. Okay, there may be other organs that can cause you to have difficulty breathing, but I want to show you these two. The problem may be coming from your heart or from your lungs. So your heart, if it's heart failure or you're dealing with heart problem or something like that, you can have difficulty breathing, especially with heart failure. Difficulty breathing when you are or doing something on exertion, like you are doing something, walking, just a normal walk, you can have difficulty breathing. Maybe you are lifting something, you're having difficulty breathing. Maybe even if you are sweeping, you find it difficult to breathe. Even if you are bathing, you find it difficult to breathe. That's when you notice any of this exertional dyspnea, it could be that you are having heart failure or probably having any heart condition. Do you get it? So when you notice that you have difficulty breathing, you should not what, ignore it. Do you get it? Excellent. Then with the difficulty breathing, so it could be as a result of problem from the lungs. So as I said, it could be as a result of pneumonia, some lung infection, or some lung cancer or something. Anything with the lungs can also present with difficulty breathing. And if you are anemic, one of the things a lot of people don't realize that if they are anemic, they find it difficult to breathe. Shortness of breath, easy fatigability can all set in. That can tell you that you are anemic. Your blood level is low, okay, and your oxygen demand is high, but then your blood is not being able to serve the oxygen to the very important cells and body parts of the body, and so that's why you're finding it difficult to you get easily tired, okay, or you easily get tired. So once you notice this difficulty breathing, you need to rush as soon as possible to the hospital for further management. And yes, sir, which ego. All right. So I've mentioned 7 things. I said I'm going to give you 10. Okay, I've mentioned 7. So let's look at the 8th, and then we'll look at the 9 and the 10. So the 8th one, when you see blood in your stool or urine, it's never normal. Okay, the 8th one, if you see blood, I mean blood, sometimes blood stain in your stool or your urine, it's not normal. Okay, don't ignore it. So one of the things you need to always do, if you are weary, okay, this is what I suggest you should do. If you are weary, the first thing you should look out for your weary is the color of the urine, okay, and the smell of the wee because they can tell us what is happening. Then once you are done with the wee, okay, look again at the color of the wee, and then also maybe you can look at if there's foamy fruit, like kind of how shall I put it? Like there's a kind of uh, dark how should I even? I want to like you can see some strains of stuff in substances inside the urine. Yeah, just take note of those things. So anytime you urinate, kindly don't forget to add that to your urinating process. Okay. Then anytime you go to the toilet to go and defecate, one of the things is to after you have defecate everything. These are the two things you need to do, or three, probably depending on check the color of the stool. Okay, to see if it's black. If it's black, there's something that comes to your mind and let us know if there's blood stain inside, if the blood is stains inside, or the blood has mixed with the stool, the feces. That's what I'm trying to say. Take note of that. And then as well to make sure you check the tissue, the toilet paper that you used to, excuse me if you are eating, pardon me, but then the toilet paper you used to clean your anus, check the color of the tissue. Probably it may be stained with blood or stuff. That can also give us a picture of what you're dealing with. So anytime you see blood in your urine too, don't ignore. Your body is trying to warn you, tell you a lot of things. Maybe you are bleeding somewhere inwardly, but you are not aware. You're having hemorrhoids, or you're having some what we call colon cancer that you don't. Your body is trying to warn you about. So you need to not ignore. Okay. So else, which ego means that you think you are okay, but your body is trying to tell you are not okay, and you think I'm okay. You think you are okay, but however, you are being exposed, which ego. All right, so let's continue. I said I'm going to give you 10 things. I've mentioned 8. It's left with 2. Let's add the 8 quickly. Don't forget to share this video to your loved ones and friends as well. Okay, so the number 9. Okay, if you have persistent headaches, very, very persistent headaches, you should not ignore this. If you ignore it, which you ignore. Now, let me share with you. There's this particular time I had one person coming in and was like, oh, he feels headaches at this side of the head. He'll be feeling beat, pop, 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 pop. But he does not usually take it for granted. Like, oh, it's one of those things. And he's a very young person. Oh, it's one of those things, one of those things, one of. Then there's one particular day. Okay, apparently he's also on some hypertensive medications, but he's not compliant on the medications. Then one particular day, he woke up in the morning, going back to his usual stuff. Then he had that sharp pain again on the pum pum pum. The only thing he could remember was that he was rushed to the hospital. All right, and then his level of consciousness was very, very, like, I mean, his GCS. When we say GCS, like what, like we assess when people come to the hospital. We used to assess people, their level of whether they are alert or conscious or stuff. And this person was very, very low. His consciousness was poor. In fact, the person did not make it, sadly. Okay, but then what I'm trying to point is that when you notice that you have persistent headaches for quite a number of time, especially if you're hypertensive and you are not taking your medication, you need to be warned. You need to be alarmed. Your body is warning you. Okay, because you can have what we call the blood vessels on around your brain can burst, and when they burst, that's what we call hemorrhagic, and hemorrhagic stroke. You can have stroke, and that hemorrhagic stroke sometimes is very, very, very serious, and you may not recover again from the damage that has happened on the blood vessels. So I advise that if you are hypertensive, especially, then you have some headaches, and the underlying cause is that you don't take your medications, you need to warn yourself. Try as much as possible taking your hypertensive medications, because hypertension is a silent killer. So if you know your grandmom, your dad, your brother, or some sister who is hypertensive and they have deliberately refused to take their hypertensive medication, sometimes they have some herbal medications. They say, oh, this herbal medication it cures us once and for all. And then they may initially may not be showing the symptoms again of maybe chest pain, no palpitation, not be feeling that their hearts are beating very fast again, no leg swelling. So they may think they are fine. And then by the time they realize it's too late, pump, then they have some stroke, because uncontrolled hypertension can lead to stroke. And if you remember the last time I did on stream, I talked about uncontrolled hypertension can cause heart failure. So those are the few things I've mentioned. So I said I'm mentioning 10. I've mentioned 9. So what's the last one? Let me know if you are following. Kindly drop in the comment section any of the 9 things I've mentioned of heart, of I said I'm going to give you 10 things. If you don't know it, which ego. So I've mentioned 9. Kindly drop in the comment section at least one. At least one for me. Let me see that you're following me. At least one. At least. Let me know. Okay, Betty Espana or Benisuos. You can drop in the comment section. Any one I've mentioned. I'm going to give the last one and we are done for the day. Okay. Yeah. Okay. Oh. So you can share this video to your loved ones. Let them come and rewatch the videos again for us. Okay. Okay, so let me, because it's late, let me add the last one. Quick. Yes, I cheat ego. The last one is when you have a poor wound healing. Okay, so if you know of someone who has a wound on his body for a long time, the wound has refused to heal, don't ignore it. Yeah, I know many of times people usually ignore it. Sometimes they want to treat it on their own, use some hot water and some stuff to treat it. But then when you have a wound on your body for a very long time, it's refusing to heal, don't ignore it. Your body may be telling you something that you 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 are actually trying to ignore. Now, when you have a wound that is not healing, especially if you are diabetic, because diabetic, one of the things it does is that it gives what we call poor wound healing. So if you're having diabetes and your wound are not healing well, as soon as possible, make sure you get to the health professionals for further management. Else the wound becomes infected and a whole lot of complication. It can even lead to amputation of your leg. So especially if you are diabetic or they have ever told you that your sugars are very high or you are pre-diabetic and you have cuts or wounds, make sure you treat your wound very well because sometimes it becomes very difficult to treat to get your wound healed. And then also, if you know you are diabetic, as much as possible, try to avoid cuts. Because if you are diabetic and your sugars are not well controlled and you get any cut, it can become very difficult to heal. So I've mentioned 10 things today that will tell you that Wechi Eguho. If you don't know it, Wechi Eguho. Hopefully tomorrow I'll add another more so that you know that Wechi Eguho. So if you see someone and you see the back, know that the person Nichi Guho because he or she does not know these 10 things I've mentioned. I hope you have learned something today. Thank you so much for joining this live to this point. I sincerely appreciate each and everyone who joined and each and everyone who shared the videos and each and everyone who passed through. I thank you all for joining. I thank you guys so much. Okay. Until then, see you. Bye. Take care. I really appreciate.